Ladies and gentlemen, welcome to the Independence Center's ADA Advancing Disability Friendly Healthcare Luncheon. That deserves a round of applause, I agree. So, hello everyone, my name is Katie Pelton, and I am a reporter and anchor with KKTV 11 News, and I am so happy to be a part of this today and so excited to be here. Please join me in giving a round of applause to A Positive Note, who has been providing the lovely music for us this morning. A Positive Note is here courtesy of the Colorado Springs Conservatory. Their music has just been awesome. I love having that this morning. This is the Independence Center's 5th annual luncheon celebrating the anniversary of the passage of the Americans with Disabilities Act. This year, we're focusing on the need for more accessible medical services for people with disabilities here in Colorado and all across the country. At this time, we'd like to acknowledge all sponsors who have made this event possible. In particular, we'd like to invite Maggie Sims from Rocky Mountain ADA Center, Summer Galsarin from Rocky Mountain Healthcare Services, and Rob Rubel from Cascade Investment Group to accept a gift from the Independence Center for being our promoting sponsors at this year's ADA event. Thank you so much. In addition, we'd like to thank our other sponsors, including premier sponsors, Sprint Relay, NAMI, the ARC Pikes Peak region, First Bank, Central Bancorp, Colorado Community Health Alliance, Denver Management Advisors, UC Health, and Raymond James and Associates. We'll give them a round of applause too. This event is also supported by table sponsors Invita, Medical Accessibility LLC, RTA Architects, Comprehensive Computer Consulting, and Haynes Mechanical Technology and Energy Solutions. And we'd also like to acknowledge Mayor John Suthers and all elected officials who are present here today. We truly appreciate all of you taking the time to be here with us today. On July 26, 1990, George H.W. Bush signed the Americans with Disabilities Act into law, establishing a federal mandate to eliminate discrimination against people with disabilities. Today, we're here to celebrate the progress that has been made and to discuss the work that still remains for us. Many thanks to everyone here today for taking time out of all of your busy schedules to support our community and the efforts to advance disability right here in Colorado. As you prepare for lunch, please take a minute to complete the contact card that's located at your tables. At the end of our luncheon, please drop off those cards at the registration tables at the front of the building, and each person will receive a gift bag courtesy of our event sponsors. I'd also like to mention that after the ADA event ends, our keynote speaker, June Kales, will present a workshop on advocating for your healthcare as a person with a disability. This will take place from 1 o'clock until 3 p.m., and it'll be across the hall in the Foothills Conference Room. If you didn't have the opportunity to RSVP, don't worry, there's still some spots available. While lunch is now on its way for you, it's my pleasure to introduce Drew Wills. Drew has served on the Independence Center's board since 2015 and was the board chair in 2017. Drew's commitment and contributions to the IC are very significant. His passion for improving the lives of people with disabilities cannot be overstated. Please join me in welcoming Drew.
Thank you, Katie. Thank you for your warm introduction. I'm very pleased to be here today. I want to thank all of you that are here today. It's a great showing, and it is a great day for people with disabilities. I'm pleased to be here for another anniversary of the Americans with Disabilities Act and to talk about the need for accessibility in healthcare in the Pikes Peak region. I was asked to join the board of directors of the Independence Center in early 2015. At that point, I'd been using a wheelchair for about 10 years due to a spinal cord injury. I was very fortunate to have excellent health care and rehabilitation. That, along with a devoted family, friends, and supporters, allowed me to get back up, regain my independence, enjoy life again, and get back to what some people have phrased in my rehabilitation as the business of life. Since then, I've been to many places, never thought I would visit, seen things I never thought I would see, met many people who have inspired and enriched my life, and accomplished things I never thought possible. For all of us, disabled or not, I believe that it is independence, the ability to exercise our own self-determination, that allows us to create and maintain an existence where we can look forward to all the important blessings of life. I had previously served on several nonprofit boards in town, both before and after my injury. But the Independence Center was unknown to me until I received a call. When I read the mission, looked at all the Independence Center does for people with disabilities, met the CEO, the staff, and all the other board members, I really couldn't resist. I have thoroughly enjoyed contributing and working with all the talented members of the board, the staff, and everyone else to support the IC's mission. The current members of the board, and please stand if you're here, are Joe Faking, Lynn Pells, Karen Sullivan, Tim Rowan, Denise Hawk, Jeremy Chatlin, Tanan Miles, Rich Lewis, Beth Lake, and Clay Martin. Please join me in giving them a big hand. It's the people on the board and the staff that make the Independence Center such a great place, such a great asset to the community, the state, and even the country. Today we celebrate not only the anniversary of the ADA, but also what we hope is just the beginning of improving access to health care in the Pikes Peak region. We have such a wonderful opportunity, not only to improve the lives of people with disabilities, but even to save lives for people with disabilities. Removal of the physical and social obstacles in healthcare is a critical part of allowing people with disabilities to manage and maintain their own health needs while enjoying and participating in the community. Some of the ways we can do this is by ensuring that there is appropriate parking available, that healthcare provider buildings are accessible, that examination rooms are large enough for wheelchairs, that the exam table can be raised or lowered to accommodate a transfer, and that even a mechanical lift, if necessary, is available to make that safe transfer. That a scale is available even on a table or even a separate scale for people to be weighed. And that hearing devices are available for those who cannot hear. The good news is that all this can be done. It's all within our ability to do, and it just takes a little bit of effort. Being part of the board at the Independence Center, I've met some incredibly passionate people, but none more so than the CEO of the Independence Center, Patricia Yeager. Patricia's, yes. Patricia's career encompasses a lifetime of work in public policy, disability education, services, and advocacy. In the 1980s, Patricia was an appointee of Denver's then mayor, Federico Pena, and she was appointed to the Commission for People with Disabilities. Patricia has a bachelor's in education from Marshall University, a master's in rehabilitation counseling from West Virginia, and a doctorate in human rehabilitation from the University of Northern Colorado. But most of all, Patricia is a dynamic leader, a tireless advocate, and a great asset to our community. Please join me in welcoming Patricia Yeager.
Drew, thank you for such a nice introduction. Drew's finishing his second 2-year term and will be off the board in December. And we are so much better for your contributions and support. We are really going to miss him. I want to thank not only Drew, but the whole board for all of their work. It's a passionate board, and we have a lot of fun together. So please go ahead and eat. This is a little different than usual. We're gonna talk while you eat. So if you wait till we're done, you might not get lunch. So please do eat. So you heard Drew speak a little bit about primary medical services accessibility, and I would like to elaborate on that thought. That's the whole theme of our show today, our program. The lack of access doesn't just impact people with disabilities when they show up at the doctor's office. When people go to the doctor's office and their experience is consistently negative, they don't receive the quality of services that others receive. They are less likely to go back. They're less likely to get an annual exam and less likely to receive preventative care. So they're less likely to have positive outcomes. Since 2014, we have conducted 3 focus groups, and participants reported a number of barriers they faced in accessing healthcare. These barriers included difficulties with transportation and parking, office spaces, which are too small, inaccessible paperwork, negative attitudes towards people with disabilities, and having to travel outside of Colorado Springs to find basic medical services. This lack of accessibility becomes clear when you look at the disparities that exist for people with disabilities versus the general population. For example, the cohort of people aged 18 to 44, of that cohort, 9% of people without disabilities have cardiovascular disease versus 15% for people with disabilities. Obesity rates in our community are 11% higher, and 22% more people with disabilities engage in no leisure time physical activity. According to the National Institutes on Health, adults with disabilities are 9% more likely to die than adults that don't have a disability. And one of the reasons for that is that the healthcare just wasn't designed to include people with disabilities. As more and more people acquire a disability through birth, accident, or the aging process, this becomes even more unacceptable. We're going to play a short video now with several individuals who locally have faced significant challenges when trying to access medical care. So continue eating and we will show a video. In this video, you're going to be hearing from people with disabilities from across the state about their experiences in getting health care. We want to raise your awareness, help people around the state become aware of the problems that people with disabilities face in getting health care. And we also want to talk about helping healthcare professionals do better by offering disability etiquette, so that you know how to implement or how to talk to and be welcoming towards people with disabilities so they will come back and get services rather than end up in the emergency room, which is not conducive to their quality of life and is certainly much more expensive.
For right now, the main thing I have is I can't get a pap smear. I can't use the bottom half of my legs very well because of spinal stenosis and neuropathy, and so I can't get on the table to where they can give me a pap smear, which is really bothering me because the last pap smear I had, which was about 3.5 years ago, they saw growth, and so I'm concerned about that because, as you know, there's cervical cancer, and without the Hoyer lift, I am absolutely paralyzed in helping myself get anywhere, getting a weight. And so I'm frustrated because there's nothing else left I can do. But God, there must be millions of people like me who are paralyzed from the bottom up. They can't get a pap smear or something. I can't believe this.
Because of the lack of accessibility, there are a number of treatments that I can't have. One being weight. One of the major issues, though, is pressure sores, being in a wheelchair. And to describe to a primary care physician, I've got some skin concerns, but nowhere for them to examine me. Sometimes we'll try very precarious transfers onto just a small patient table, but that terrifies me. I'm aware of quadriplegics that have been dropped and broken their neck a level higher. And if I were to sustain a different type of spinal cord injury because of it, I would lose the ability to drive. I'd lose my occupation. It just terrifies me. For me to go try to be treated for any condition or even just a well care visit, but not to be able to have that entire examination is just really inexcusable. For an able-bodied person to walk into a clinic and the hospital say, "Oh, I'm sorry, we don't have needles to give you the transfusion today," or to say we don't have a stethoscope to listen to your heart even though you have cardiac disease of some sort. That would be intolerable in society. People would be at such an outrage. Yet, for a person with a disability, that's what we face every time we go to the doctor.
I kind of see the issues with hearing loss from both sides because I've been a patient with hearing loss, but I've also been a healthcare provider with hearing loss. It impacts not my ability to get into a place to get healthcare like it would with someone with a physical disability, but it certainly impacts my ability to access the information once I get there, and even before that, when I call to make my appointment. Sometimes with more and more stuff being done on the computer, sometimes the person talking to you is looking at a screen either down below them or off to the side, and they're not making face-to-face eye contact with you. Many of us with hearing loss rely on reading lips to supplement those pieces that we miss. And most people at the reception desk really don't seem to be aware of that with people with hearing loss. And I think that's an issue for people with hearing loss, but it's also an issue for people with cognitive disorders. It's also an issue for people who are just busy and distracted.
We spent some time in this video talking about healthcare and the costs. So there's two impacts that happen here. One is the quality of life that person has, and the other impact is, of course, the cost. We know that emergency room treatments are most expensive and can be prevented with primary care access. So our whole point here is to make primary care, specialty care clinics accessible and usable for people with disabilities. And you do that in two ways. You make their service, their facility, their equipment accessible to them, and you make sure that the people who are treating them see them as people and see us as people and provide quality care as they would to anyone else. We want to move into disability etiquette. And the attitude that you as a care physician, as a care provider have towards that consumer or your patient will determine whether or not they come back, whether or not they follow your protocol, and if they don't, then they're going to be even sicker and their quality of life is going to deteriorate and our healthcare dollars will be unnecessarily spent. We do a lot of things in doctors' offices to make people without disabilities feel welcome. Magazines, water, all those kinds of things, TV, but we do nothing to help people with disabilities feel welcome. And then we wonder why this cohort, this group, ends up in an ER situation as opposed to going to their primary care physician.
Honestly, I think the stigma is very, very high within mental health. I was in an accident last year, and so I was on the scene for a little while, and I felt I needed to go to the ER. So they called an ambulance, And so I hear him calling in to the ER, and I disclosed, do you have any issues? I said, well, I have a diagnosis of bipolar. And it's interesting how it all shifts from medical to even saying, well, she says she's bipolar, so I don't really know if this, how real this is. I don't. And it was so dehumanizing for him to prejudge me based on my disability. That happens quite a bit. This stigma is a huge barrier for me. It's very difficult for people to take me seriously, and so many times I take my husband, and then it's like, okay, now you have credibility because he sees this and we take his word for it, but not me.
When they just talk to me and then I say, I can't hear you, and they just speak louder, my eyes get all, I look at them and I try to make them understand I'm deaf. Then I see this facial expression that obviously makes me feel like I'm a burden, and I don't appreciate that. And they get upset and they think I'm dumb or, stupid, or, oh, like they should know better, or I should know better. And those situations are not the kind of things that I like to experience. I can give them the benefit of the doubt, and I understand that mistakes happen, but when they're willing to come halfway and give me the confidence as a deaf person to know that they're trying, I really appreciate that person, and I do go to them more often when I can.
I actually ended up hurting my foot, and I had to go see a specialist. They told me that I needed to ask the person that I was with to come back, and I asked them why. And they told me that because I was blind, I had to have someone with me, and it was a rule in that office. And they said, well, then we'll have to reschedule. And I told them I couldn't reschedule because I was about to leave town. I kept asking and I kept pushing, and so they went back to ask the doctor, and the doctor said no, I had to have somebody with me. And I asked, why? Is there something that I'm going to be doing back there that requires an extra amount of assistance? And they said, we can't talk about that. We can't tell you what happens in the back. But as soon as I pulled out my phone, they were like, well, maybe we can work this out. And so eventually they did end up letting me in, and it was all fine. I didn't need any extra assistance. I found out I needed to wear one of those foot cast boots. I needed one of those, and if I had just gone on my trip without it, I could have caused more damage to my foot.
So now you've seen how people with disabilities, with physical disabilities, experience healthcare or lack of it. You've seen how the etiquette, the healthcare professionals' attitudes and their assumptions about about the person with a disability, how that impacts care and how it impacts the individual. So we're asking you to help us in terms of, we really need to have our Medicaid division in this state conduct surveys, identify where are the accessible healthcare facilities and clinics around the state, and make that available on a website so that I as a consumer can decide to go to a physician who understands people with hearing impairments. So that we can make those determinations, but we need that information. And secondarily, and most importantly, we need physicians and healthcare providers to have training around how to interact with us in a respectful and encouraging way that brings us to come back to continue our healthcare and avoid a deterioration of our condition, ending up in the emergency room. But we cannot do this alone. And we need help in convincing the physicians and the healthcare professionals to take these steps so that we can receive the health care that everyone else receives.
For more information, contact the Independence Center at 719-471-8181 or at www.theindependencecenter.org.
Wow. Wow, that was powerful. And I want to thank Donna, Jeremy, Ann, Chandra, Jana, and Rebecca for sharing their stories. These are examples of the challenges that people face every day when trying to access medical services. We need people like these who have the courage to tell our stories and to speak to medical professionals about the challenges we all face. And to let everyone know that gaining a disability doesn't mean you have to give up access to health care. Please imagine what it would be like to go to the doctor and not have access to being weighed or receiving preventative examinations. This has the potential to affect the medication dosages, decisions about treatment, and it could even affect a physician's ability to recognize a medical condition that could be fatal. As Jeremy said in the video, it's truly unthinkable that the needs of this growing segment of society seem to be so casually overlooked. Well, this is pretty serious, so we're going to introduce a little lighthearted view of all this. I want to introduce June Kales, our keynote speaker. June and I have been friends for many, many years. She comes from California, where she's a highly respected disability rights advocate and consultant. June is recognized worldwide as one of the original leaders of the independent living movement. She is the Associate Director and Adjunct Associate Professor for the Harris Family Center on Disability and Healthcare Policy in Pomona, California. She's worked with FEMA, she's worked with Centers for Disease Control, Department of Homeland Security, and Health and Human Services on policy, planning, and training. For the last 7 years, she's held a presidential appointment to the United States Access Board, which sets most, if not all, of the access standards we live by today. She has served as both their vice and their vice chair and chair. In her presentation, she's going to take a humorous look at what we wish we wouldn't see in healthcare. So, you know, sometimes we just have to stop and have a laugh before we go back to the arduous task of creating change. June?
Thank you, Patricia. Okay, how's the sound? Okay? Good? All right. Well, this is a variation on a theme from what Drew said, from what Patricia said, from the content of the video. So I had a really hard time picking a name for these remarks. I thought, well, the joys of healthcare through the disability lens, the hidden healthcare heavy hassles, or what we wish we didn't see. So let me know when I'm done which you think is best. So before we start, here's my contact information, and email me or whatever. Now, I'm new at descriptive video, so give me some slack here. At the end, you'll have to let me know if I got the gist of it or not. And the other footnote here is that I know and understand that some of you may not be laughing at some of these items, as this is your welcome to my life experience, and I totally understand if you're not laughing. So now that we have that out of the way, contrary to popular belief, we, people with disabilities, have been around since day one, and we've had physical, equipment, programmatic, and communication accessibility issues since way back when. Witness this poor caveman entering his cave with the all too common experience of the narrow entrance barrier for wheelchair users. But in spite of that, we still get we still get people saying to us, we're seeing more of you people lately. And the ASL interpreter, there's a nurse here, accompanied by the interpreter, and she's saying to a diverse group of people with disabilities, yeah, you people, we are seeing more of you. And a gentleman using a service animal says, well, yeah, we're now free to move around the solar system. And a wheelchair user adds, there are daily shuttles from Mars. So here we go. This is what happens when somebody with CP tries to use one of these. Well, I don't know, it's not. Here we go. Here we go. Flying in from the solar system. And their vehicle, their plane arrives and lands at the Earth Wellness Center. So there you go. The prevailing unconscious, subconscious, magical thinking remains that we are endowed with supersonic and superhuman strength, endurance, agility, intelligence, hearing, vision, memory, and trilingual abilities. In other words, we're like Spider-Man and Superman. We're super crips, able to leap over barriers with a single bound. And here we have your mythical cape-wearing, wheelchair-flying super crip taking off.
Faster than a speeding bullet. More powerful than a locomotive. Able to leap tall buildings at a single bound. Look, up in the sky. It's a bird. It's a plane. It's Superman. Yes, it's Superman. Strange visitor from another planet who came to Earth with powers and abilities far beyond those of mortal men. Superman, who can change the course of mighty rivers, bend steel in his bare hands, and who, disguised as Clark Kent, mild-mannered reporter for a...
Okay. So, again, we're all able to leap over all of these barriers. And here we have a wheelchair user and a walker user who easily leap over killer curbs, sidewalks, route blocking fire hydrants, and sharp dips in a single bound. There we go. So, and the other thing we can do is we can navigate these very steep curves, these killer steep ramps, with alligators ready to devour us at the bottom of the ramp, if we make it to the bottom of the ramp. Or we can so easily instantly fix a lift at the steps that's broken, or when they happen to work, We can easily find the key when no one else seems to know where it is, or we can surpass the unsurpassable when we get stuck halfway up in these lifts. So then we have getting through the facilities, and the first thing we encounter is the Great Wall, ensuring no eye contact, serving as protection for the reception staff, protection from our anticipated dangerous attack. And then there's the correct height section of the counter, lowered to the right height, but then they still attempt to secure and fortify that accessible counter by piling it high with files, potted plants, computers, and computer monitors, anything to block our line of sight or our ability to read lips. And then we have the frowning wheelchair user waiting in the middle of the crowded waiting room as there's no accessible wait space with two young kids that adopt her and her wheelchair as their great and wondrous new display and play toy. And then there's programmatic access and assistance involving HIPAA and privacy at its best. The receptionist assisting a couple, both wearing dark glasses, one using a cane, the other a service animal, and she's helping them complete forms while 9 people in the crowded waiting area peek over what they are reading and anxiously await the couple's answer to, do you have any sexually transmitted diseases? And then there's the physical access. The postage stamp bathroom, the airline-sized bathroom with the great and not pretty alternative of urinals or peeing in the pot. Then we have the gauntlet, getting through the narrow, treacherous path to the exam and treatment rooms, full of obstructions, protruding objects, stretchers, ivy poles, stools, and chairs. Then we have the unusual accessible dressing and changing room, chock full of stored medical equipment, canes, crutches, wheelchairs, and paper goods that come streaming out when the door opens. And it takes forever to empty the room so we can use it. Then there's the elusive matter of getting weighed versus many of us being told, just guess your weight. Just guess your weight, and we know how that goes. So here's a happy-go-lucky plump nurse wearing a hard hat as she proclaims, see, I knew we had that accessible scale around here somewhere. Well, a skeptical wheelchair user, also wearing a hard hat, sits on a loading dock scale with a sign on the back wall that reads, WAM Health Plan, shipping and receiving, hard hat area. This is not made up, by the way. This happened. Then we have what we've already mentioned, which is the very usable exam room with plenty of maneuverability space for mobility devices. Then there's equipment access. Now, not everyone can do this, but this is me on a bad hair day demonstrating my breathtaking Circus Soleil act using well-placed grab bars to mount a very high exam table. Good luck with that. Then we have the infamous instructions to just hop up. So here we have the cooperative wheelchair user explaining to the uninterested doctor, I know I can get my wheelchair through the door, but I don't know how I'm going to get my body into that machine. And that machine looks something like an iron line from the Dark Ages. Then we have the X-ray tech obliviously pointing to the super high X-ray table with the icicles hanging off the edge, while the puzzled looking, shivering barefoot walker user stands there with her frozen blue butt popping out from the open at the back hospital gown. And she's envisioning, in her mind's eye, a table of ice cubes. And y'all know how easy it is to move when you're freezing, in addition to staying still if you even manage to get on the table. And here we have, I'll let her do her thing first. So this is an obnoxiously cheery, white coat-clad doctor who's instructing a frowning, perturbed-looking wheelchair user wearing a hospital gown, again, open at the back, to just hop up. She crosses her eyes, jumps on a trampoline, does a triple backflip, and lands backward with her head resting in the exam table stirrups to a roaring applause. So I don't know if I could replay that or not. Let's see. This thing does not like me at all. There we go. Here we go. Triple back. Oh, backwards. Okay, here we go. Triple on the trampoline. Triple backflip. And lands on the stirrups. Yeah. Oops, not yet. And then we have programmatic access gone very, very wrong. The doctor explains to the annoyed-looking wheelchair user, we'll just examine you in your wheelchair. Anyone have that experience? Okay, well, it looks like this. So what happens here is the poor wheelchair user is hoisted up on a gas station vehicle lift, and 3 workers zoom in with their drills, their air pumps, their grease cans, and various other tools, which I have no idea, to work on him. How cool is that? Not cool. Okay, then we have the blended equipment and programmatic access issue of getting on the table. Even when a height adjustable table is in place, some people still need transfer assistance. And here we have a jolly nurse wearing blue scrubs, driving a forklift with a sign, TLC, know what that means, right? TLC, Tender Loving Care Health Plan. We're innovative. She exclaims, "We've got that transfer assistance you requested." And she's talking to a group of diverse, dazed people with visible disabilities looking her way. And here's one. I just haven't produced this yet, but I couldn't resist sharing it with you. And it goes something like this. They're saying to a wheelchair user getting a mammogram, "Could you just stand up for a minute, please?" You mean you can't even stand up for just a minute? Or, "Could you take that ride out of your back so we could get a decent picture?" Okay, so really, this brings up something, just a side issue, but something a lot of us women feel needs to be stated. And then it's expanding view of gender equality. Since women believe mammograms were invented by men, we want to also see some gender equality and inclusionary practices in this area. And thus, we have people love this one. We have the manogram with, you guessed it, the same squeeze experience women have to endure. Only for men, it's a bit lower. Okay, remember that one. Okay, and then we have communication access. This doctor is so proud of repurposing his stethoscope as an assisted listening device as he shares the earpiece pieces with his patient while using the opposite end as a makeshift microphone. And he's yelling, "Can you hear me now?" And there's the assumption attitude thing. There's a bias that if you have a disability, you've crossed the line from health to sickness, and you've fallen off some health cliff because disability and health cannot exist. The assumption is never to return to health again. A disability means you're sick, period. The assumption being that the quality of our life sucks. Witness this group therapy session depicting people with a variety of visible and hidden disabilities passing tissues around, crying, looking depressed, sad, and despondent, while the jury facilitator is making her comments. And then we have the all-knowing doctor telling a sad-eyed wheelchair user, "If I were you, I'd smoke too. I'd drink too. I'd overeat too, and I'd be depressed too." And then we have the never-ending plea for people to update their antiquated, negative, stereotyping, disability-related language that rarely updated language thing. So outside this accessible, unisex restroom with a sign reading handicapped bathroom, a walker user says to a wheelchair user, "I sure hope this toilet is not handicapped. I really need one that works." as he pictured in his mind's eye a handicapped, tilted, wobbly, and multiply cracked, broken toilet. And the press, also does a job on us with their language. It's an article in which they wrote, ignoring the need to update any language, they describe these early morning shopping mall walkers as even including a stroke patient and an MS victim, because we never shed that victim or patient label. So here we have these mall walkers with a doctor and a stethoscope pressed to the walking so-called stroke patient's chest. And in the back of the line of the group is a walker user followed by a medical tech in scrubs, and that's probably the MS victim that he's following. So there you kind of have it, a brief glimpse at the hidden hassles of the disability healthcare experience, which is not simple, and it's all about the details, the diversity, the nuances, and the complexity of living with disability. So, as you now know, I'm not really a comic, but I spent decades trying to get these points across in more impactful and indelible ways. And you've been exposed to a slice, only a slice, of my attempts. I'm always collecting new ideas, so please share your ideas with me, and I'll see if I can convert them to something, some kind of cartoon or something that just helps to get the point across in another way. So lastly, on this link here, I know these kind of scenarios, they never occur here, right? You guys have this all together. There's no magical thinking in this group, but just in case, I leave you with some resources you could use to decrease any of that magical thinking that others may have. So there's a resource for you at this link, which is www.jik.com /temp, TEMP /HN.html. That's a mouthful, but if you get that down, just email me and I'll send it to you. So that's it. Thanks for listening. Here's my email, and thank you.
So I'm curious, I know there's a lot of people in the room with disabilities. Could you applaud if any of this applied to you? I can't, when I went in for surgery and the whole surgical suite is in mask and they start talking to me and I can't read their lips, it's like, oh well, and then they put me under and I didn't have to worry about it anymore. So thank goodness for that. June, thank you so much for giving us an enlightening view of healthcare for people with disabilities. And believe me, this is not an exaggeration. It's a humorous look at what we all go through, and I'm hoping we're going to be able to change this. You've given us important context about equal access for healthcare for people with disabilities. We believe that, the IC in particular believes that part of spreading medical accessibility is to demonstrate an alternative way to the current way that examinations are provided, and offering an incentive so medical professionals can embrace the adoption of technology necessary for expanding medical accessibility. Well, the medical system in this town has heard me loud and clear about this, and I decided we needed to be nice. So in 2018, we set aside $75,000 from the IC fund to bring better accessibility to medical practices around the Pikes Peak region. We held a contest and challenged people receiving Medicaid or Medicare with disabilities in our 6-county area to nominate their primary care doctors. For the providers who received the most compelling nomination, we purchased an accessible exam table with a scale. We also placed a Hoyer-type lift in their office so that they can transfer their patients more safely. And we put a hearing loop in so that people who are hard of hearing or cochlear implants can communicate. At the end of the contest, we had accessible equipment delivered all across our catchment area, including El Paso and Teller County, and reaching as far east as Cheyenne Wells. The accessible equipment from the fund can be found in the following 10 locations. The Value Care Clinic got a hearing loop. They already had two lifts, 2 tables that lifted. Centerpoint Family Medicine, the office of Dr. Charles Ripp, Eastern Plains Medical Center, Matthew View Medical Group, the Teller County location of Peak Vista Community Health Centers, Prairie View Clinic in Kit Carson, the SET Clinic in Colorado Springs, Summit Medical Clinic, and Sunrise Healthcare. I'd really like to give them all a round of applause. As a result of putting all of those out there, in 2018 we knew of 1 or 2 tables. Now we know that there are around 40 tables located in the Pikes Peak region. Peak Vista found a number of tables. Other Medicaid providers have put tables in their offices. So you can visit our website and see the locations so that you can make a choice to go to an office that is accessible to you. So the IC Fund this year will be investing another $75,000 to make dental care disability friendly. We're planning to work with the dental health care providers to expand accessible dental services to people with disabilities here in the Pikes Peak region. So we're again asking people with disabilities on Medicaid and Medicare to nominate a dentist that you think should be accessible to people with disabilities. There are also other solutions that make dental care more accessible to the deaf, people who are blind, those with head injuries, and mental health disabilities, and we'll be sharing those with the dental practices. You can also go to our website and see what we learned from having focus groups with people with disabilities talking about their experiences in the dental chair. So I encourage everyone out there, people with disabilities, to please nominate a dentist, and we will see how far this money goes in making dental services accessible to people with disabilities. I'm so pleased that we have here today one of our primary care providers who participated in our accessible medical equipment giveaway and accepted the equipment as part of the initiative. We also have a few of the individuals who took the time and had the interest to fight for more accessible health care and nominated their providers. From the bottom of my heart, I would like to say thank you to all of those people who took the time to nominate and who took the time to accept this equipment, because it's going to make such a difference in health care in our region. Thank you so much.
So good afternoon. I'm Betty Jo Schoberg. I'm from Presque Isle, Maine. That's northern Maine. It has a population of about 7,000. I moved here 2 years ago in 2017 to be near my daughter and son-in-law and now 2 grandchildren. I have found since I've been here that there is a big difference from an area of 7,000 people to a city of 450,000 at least. And I had a difficult time when I arrived. I don't know why. I naively thought that it would be easy to just move here and not have any issues finding care. However, I found that not to be the case. There are a lot of hoops to jump through for a disabled person. And I'm just very grateful for the Independent Center. They have helped me with obtaining another grant because when I was actually fitted for a more appropriate wheelchair, it was too heavy for the lift that I currently had in my van, and I was able to, through Paul Spots and the Assistive Technology Department, obtain grants in order to put in a lift that would actually lift this wheelchair. This wheelchair is probably about 450 pounds, and it is awkward for the balance. To have the balance with a large wheelchair like this, I do have some back wheels, and I have made a few dents in walls and things like that. And I should probably tell you, I have limb-girdle muscular dystrophy. It's a progressive neuromuscular disease, subtype 2A, which they are starting to do more genetic testing and finding out what the patterns of inheritance are, as well as some of the prognoses. And I also have something, it's a connective tissue disorder called Ehlers-Danlos syndrome. And that affects my ligaments and my joints. So I really need to have medical equipment that's accessible. And I can't have people yanking on my arms or my legs because I'm prone to dislocation. So I had a lot of concerns when I arrived. There's a lot that still needs to be done as far as accessibility in the city and in the surrounding areas. When June was talking about killer curbs, I could relate because one time I did last summer go over a curb. There were curb cuts on every corner, but apparently there wasn't one on that corner. And I did tend to fly through the air, and I did break my right arm, and I'm right-handed, so it's been a little bit of a challenge, but I'm becoming ambidextrous. But yeah, I mean, there's so much that an able-bodied person doesn't really think about, you know, and it's extremely important for our safety and our health that these issues are addressed. And so when I saw that the Independence Center was taking nominations for medical offices to receive adaptive equipment, I was thrilled because I had put off a complete examination. I thought, well, there's no way I can get on that exam table. And most of you know that when you go to get up on that exam table, there's a little step attached. Well, you know, if you step on that and you're trying to get up, which is impossible for me, that thing tilts. And that's scary in itself. So I've been putting it off and dreading it. And, you know, when you walk into a medical office, and June did such a good job portraying it in a humorous way, there are barriers. And in a medical office especially, that really ought not be so. So you go in and you do have those barriers that she mentioned, and sometimes the rooms are rather small. For this type of a wheelchair, it's quite large. It's very difficult to maneuver, but thankfully at the provider that I go to, they do move chairs before I come in. They know I'm coming in. But yeah, that exam table, that just was scary for me. How would I ever receive another complete examination? I wasn't sure how that was going to happen. So when this happened and they asked for nominations, I nominated Matthews VU Medical Group, and they have been wonderful. And now they do have an adaptive exam table as well as a Hoyer lift for those who need it. So far, I could probably make a transfer, you know, into a lower table, but a lot of people, they need that Hoyer lift because they, you know, they are not weight bearing at all. And so I'm just thankful that they presented this and then they awarded various healthcare providers the adaptive equipment that makes it so much better for us, safer and also more comfortable, because you know, when you have a disability and then you already feel different and people feel a little awkward around you at times, then you go into a medical practice and they're scurrying to try to find a way to accommodate you, which, you know, it's great that they are. They're wonderful. However, you start to feel very self-conscious as they scramble and try to make things work for you. And to have things in place, I cannot express to you what a difference that makes. And then we don't go in there already feeling apprehension, feeling self-conscious, feeling awkward. We feel more comfortable. And at that point, we feel, I think, more apt to talk and share our concerns with our medical professionals, and also just, you know, feel an overall sense of being cared for. And I think that's very important. You know, disabled people, they come in all shapes and sizes and all kinds of disabilities, but you know, the one thing is they deserve our care and our respect. And it's very important that we do that for every human being. And we're starting to realize, people are becoming more aware that these adaptations need to be made for these people. And I'm just grateful to be a part of it. I'm glad my nomination was accepted. And I want to do my part to help going forward to make positive changes in our area for the disabled. Thank you.
Good afternoon. How's everyone doing? Good. My name is Rachel Bletzacker. I am a registered nurse and the practice manager for Prairie View Clinic in Cheyenne Wells, Colorado. Prairie View Clinic is associated with Keefe Memorial Hospital. We also have an outreach clinic in Kit Carson, Colorado, which is about 25 miles west from where we're located in Cheyenne Wells. That clinic is open 2 days a week. So we offer care in 2 separate rural areas, five days a week, but 2 in the smaller area. My guess is that many of you have probably never even heard of Cheyenne Wells. It's a rural community located in eastern Colorado, about 2.5 hours from Colorado Springs. So we are literally on the Kansas border. According to our 2010 census, we have a population of around 1,000 people. Kit Carson is, as I said, 25 miles west of Cheyenne Wells with only 230 people. Both towns are located within Cheyenne County, making that a grand total of around 1,800 people. So in other words, we truly are the frontier. As the only, as the only healthcare provider within the area, our clinics treat people of all ages, from birth to age 100 and more. Our patients are not your average 9-to-5 employees. We serve ranchers, farmers, oil workers, and currently we have we have a large amount of wind farm people in our community as well. We also have a large population of senior citizens. Many of our patients are on Medicaid and Medicare, but no matter what their age or their background, they all rely on our services to get the care they need instead of having to drive longer distances. When we examine a patient, we're committed to giving them a complete head-to-toe examination. That's the best way to ensure that you're not missing any important details when it comes to building a comprehensive health care plan for them. However, because we do serve such a large population of patients who are geriatric or disabled, many of them arrive at the clinic using wheelchairs or walkers. This can make it difficult to get an accurate height and weight because they may not be able to step on our scale. Even if they can, they're often unsteady, so not only is it hard to get correct measurements, it poses a safety risk for them as well as ourselves. For these same reasons, we've often had to examine someone in a chair or within their wheelchair. This is because we cannot safely transfer them to an exam table. If we cannot get an accurate weight or height and are unable to get them onto the exam table, we're missing very important pieces of the puzzle that have a significant impact on a patient's health. Unfortunately, up until we received the table, we had some patients with disabilities who had actually never had a complete physical exam. That's why the gift of an upscale, accessible exam table we received from the Independence Center meant so much to us. Having the table has made a big difference in how we care for our patients. It's height adjustable so we can easily transfer the patient to the table. It also has a built-in scale so that it's easier to get an accurate weight and we can measure them right on the table. Our patients seem to love this table and we all feel better knowing that they've left our office after having a comprehensive exam. We've also discovered other ways to use the table. As some of you may know, children are not always cooperative when it comes to physical exams. Now, instead of taking them to several different places within the clinic to receive their vitals, we often head straight back to the exam room, and we've had extra good luck weighing our newborns on this table. The table not only makes it easier on our patients, it's easier for our staff as well. We don't have to worry so much about workplace injuries when transferring a patient or adjusting the table to help the patient. We are truly grateful to the Independence Center and to the one person who nominated us, Michelle Chamberlain. This gift makes it possible for us to continue to improve the quality of healthcare we provide to our community. Thank you.
Thanks so much, Rachel. I actually have been to Cheyenne Wells many, many times. I have a lot of in-laws down there, so I'm sure we know each other somehow. All right. Well, I want to say thank you. First of all, I have several story ideas after watching all of those videos that we saw this morning, and so thank you for bringing that to light and bringing the awareness to our community here. I think we all can make a difference. And thank you for the stories about the impact of inaccessible healthcare and how the dynamic is changing as people with disabilities are empowered to receive the services that all of us need. For too long now, people with disabilities haven't had access to the level of care that they deserve. And I ask you today, if you have a disability and have avoided going to the doctor because they aren't able or accessible for you, please reconsider doing that. You can find a list and map of local healthcare providers who have accessible exam tables and other accessible medical equipment. Just go to the Independence Center's website, as mentioned before. Now I'd like to introduce Colleen Daywalt. Colleen comes to us from Colorado Community Health Alliance, which oversees care for people with disabilities who utilize Medicaid here in Colorado. Colleen will take a few minutes to discuss the positive changes taking place here in the Pikes Peak region as it relates to medical accessibility and the work of the Regional Accountability Entity, or RAE, to help ensure equal access to medical care for people with disabilities.
Thank you, Katie, and also Patricia. It's an honor to spend the afternoon with such a large group of dedicated individuals. My name is Colleen Daywalt, and I work with the Colorado Community Health Alliance. And I'd like to first start by saying thank you. The Independence Center has been a huge asset and resource to us at the Colorado Community Health Alliance. And What other way would you like to spend the afternoon than here with nearly 350 individuals, not only for a lovely lunch and also the great educational event that we're going to have today? I can't think of a better way to celebrate the Americans with Disability Act than here with you all, so I want to thank you for your time. The Independence Center's commitment to increasing access to services and the empowerment of individuals with disabilities absolutely aligns with the work we do at Colorado Community Health Alliance. I'd also like to thank the individuals for sharing their experiences today. I have the pleasure of working directly with members enrolled in Medicaid through our member advisory committee, and hearing those personal stories is absolutely essential for not only folks like me, but also healthcare providers. So I thank you for sharing that. I know it's sometimes difficult, and it's hard to be vulnerable in front of so many people. So I also want to give a big nod and thank you to some of the partners we have here joining us. We've been working closely with Matthews View, as you heard earlier, as well as Peak Vista, El Paso County Human Services, and last but certainly not least, our friends up at the Aspen Mine Center in Cripple Creek. So I'd like to thank them for joining us today. These are partners that are working every single day to ensure healthcare access. So as Katie mentioned, I'm just going to spend a few minutes talking with you today about who we are. Oftentimes you might hear us refer to as CCHA, and I know in the healthcare world there are so many acronyms, I can't keep them straight, and I know you probably can't either. So whether it's a regional accountable entity, a RAE, a RICO, a BHO, the alphabet soup goes on and on. But what you need to know is that we're here to help you and your family navigate the healthcare system. Colorado Community Health Alliance is actually the regional organization, or RAE, or all the other alphabet soup that you can think of, that serves the community here in El Paso, Park, and Teller County. We also serve counties up north, including Boulder, Broomfield, Clear Creek, Gilpin, and Jefferson counties. We were actually formed in 2010 specifically to meet the needs of members enrolled in Medicaid. We served for a few years up north in those counties that I listed as an entity, and then also expanded just last July of 2018, down to this area. So CCHA administers the physical and behavioral health benefits and coordinates care for nearly 303,000 people in our communities, with nearly 167,000 of those just here in El Paso, Park, and Teller County. We're committed to ensuring access and disability competent care for our members by connecting them and their families and caregivers to resources, most importantly to improve their overall health and to meet their own personalized health goals. Our goal at CCHA is to help Health First Colorado members, or Medicaid, they rolled out a nice fancy new name for Medicaid, to get the most of their health care and live healthy lives through a person-centered approach. That's something that I've had a lot of personal experience with in developing person-centered plans and patient-centered plans, and it's something that CCHA is committed to as well. We do this through nearly 100 care coordination staff. So that means we have nearly 100 staff who work directly with our members and providers every single day to ensure that there's less duplication of services and you're not having to tell your personal story over and over and over again. Our care coordinators are registered nurses. They're also social workers and behavioral health coordinators, peer support specialists, as well as community resource specialists, and they're here in your community. I'm proud of some of our team that are here with us today who work directly with our members. And if you or someone in your family or someone you work with you think would benefit from care coordination services, please reach out to us. We are here as a resource and we're here to serve you. One way that CCHA has been helping to increase accessible care for individuals with disabilities is working through our provider network that we contract with. We have nearly 4,000 providers in the area down south here, as well as up north, that we have been communicating with and increasing their education in terms of disability competent care. In the last year, we've hosted provider town halls for our physical and behavioral health providers in the community who are part of our network. And most recently, the one that we held in the spring focused primarily on providing disability competent care. We actually had an expert from the Resource Exchange come and speak to our provider network, and they We earned a continuing medical education credit for it, to hear about what they can do in their practice and how they can implement different strategies in their practice to improve the medical accessibility for individuals with disabilities. We also had some folks take advantage of one-on-one consultations immediately after our provider town hall, particularly individuals who work with pediatric patients that they know were transferring and aging out of their practice, and they wanted to make sure that they were getting connected to adult primary care providers that could meet their needs. Our providers also have ongoing access to resources to help them provide disability competent care through cultural training, cultural competency training on our website, as well as ADA requirements and communication tools. One thing that we're very proud of, and something we collaborated with the Independence Center on closely, and Patricia mentioned it briefly earlier, is working to survey and collect from all of our providers, not just our primary care and physical health providers, but also our behavioral health providers, information about the resources they provide in their practice. So whether that is a lift or an accessible scale, or other adaptive equipment that they have in their practice. And right now we're doing that surveying with the goal of making that available on our website and also to our call center or care coordination staff so that they can help coach and identify places that would be the best fit for our members. So we're really proud of that work. It's something that we've been running full steam ahead towards, and now we're in the process of actually doing the building of that communication between systems. So we're excited to launch that soon. We encourage you to look forward to that, and we're going to continue to build out those criteria that people would provide us so they know what types of resources a practice might have and if it's a good fit for them and their family. Finally, but certainly not least, CCHA is committed to hearing from our members. So as I mentioned earlier, I have the opportunity to work with our member advisory committee, which is 15 members down in the El Paso Park and Teller County who provide us guidance on how we develop, execute, and communicate our programs. And it's an opportunity for us to work directly with our members, very much in a person-centered approach that we're doing things with them, not to or for them. And that's something that CCHA is committed to continuing to do. And if you or anyone that you know would be interested in joining the solution-focused committee, I'm going to do my shameless plug of please go on our website, find that information. We want to continue to grow the presence of that group. So finally, I'd like to thank the Independence Center and their very talented and committed board for their unwavering support for individuals with disabilities. And CCHA continues to work with you as well as the Independence Center in the years to come. So thank you.
Thanks so much, Colleen. Let's give another round of applause for all the speakers here today. So I have to give a very quick shout out to my dad who's here today. This is his first time coming to this, and he's worked with people with disabilities for nearly 40 years and always instilled in me how important it is to be an advocate for people with disabilities. And I really think it takes all of us, every person in this room and every person in our community. So I want to say thank you to everyone here, and let's give a round of applause for everyone who's here in this room, including my dad. At this time, this is pretty exciting. Check the back of your program that you have on your table there. If you have a puffy smiley face sticker on your program, you're the lucky winner of your table's centerpiece, the gorgeous sunflowers that you see on your table. Yeah, that's pretty fun. I love that. Everyone loves sunflowers. Don't forget to turn in your contact card at the registration table near the front of the building as you pick up your gift bags, courtesy of our sponsors. In those gift bags, there's several fun goodies from the sponsors, and you'll also find a report on dental accessibility. Please take time to look at that report. If you have a dental provider whose practice is not accessible, nominate them to receive accessible dental equipment as part of the IC Fund's Accessible Dental Equipment Initiative. You can do this by visiting the Independence Center's website, searching Accessible Dental. There you can fill out and submit the nomination form. If you RSVP'd to participate in the Advocating for Your Healthcare workshop, that'll start here in the next few minutes. It's being held in the Foothills Conference Room across the hall. If you didn't RSVP, there's still some seating available, and ASL interpretation is provided too. We hope to see you all next year at the Independence Center's ADA Celebration Luncheon. That'll be held on Friday, July 24th, 2020, so mark your calendars. Thank you all so much for having me and for being here today. Have a great rest of your day.